As a kid, you're not supposed to be responsible for much except just playing outside and getting dirty or something. But this boy during this academic case study had to worry about toe walking, and his life was never the same once he was diagnosed with idiopathic toe walking at the age of 3. As he grew up, he began to toe walk, but he would like to run around and with his friends and play with his friends outside. After he was diagnosed with idiopathic toe walking, his parents began to be concerned, so they started to do physical therapy for 3 months. After the third month, the young boy, didn't toe walk again. And according to Acta Pediatrica by Hirsch and Wagner, toe walking is defined as performing the gait cycle on the tiptoes, which can be caused by prematurity of birth or sensitivity on the bottom of your feet or heel. And after this, the parents weren't concerned, but at the age of 8, the parents began to notice that he began to toe walk again. They sought out medical advice, and according to pediatric orthopedics, toe walking is abnormal after the age of 3. After that, or after the age of 3, it's abnormal because of the growth of muscles, tendons, and ligaments. And they didn't want to do surgery, so they deferred the surgical option, which is the lengthening of the Achilles tendon, so the kid cannot toe walk again. So they went to physical therapy, which is the conservative option, and they wanted to address any range of motion limits or what is causing the toe walking, and they wanted to get any plan together that can help the kid not toe walk again and increase his lifestyle better. During the next examination, the outpatient therapy clinic used an evaluation and they observed the running and walking gait. And the parents claimed that the patient had sensory issues before on the bottom of his feet and hands, which is usually the cause of toe walking. And during the evaluation, he walked on his toes 80% of the time and ran on his toes 100% of the time. And he lacked arm swing and trunk rotation. During the observation, they took measurements of all the range of motions, which were a little bit off. And the intra-rater, reliability should be, the active range of motion should be around 0.78 to 0.96. The passive range of motion should be 0.90 or around there. So they went to physical therapy to try to tweak that or get it better. And according to Acta Pediatrica, a typical exam would present no abnormalities but some calf tightness and the decrease of squatting normally. They finally started physical therapy, and it would last 2 days a week for 4 months. And during the 4th month, he would have a reevaluation from the physical therapist. And the goals were to walk 30 feet with arm swing to neutral, run with heel contact 90% of the steps, and squat with maintaining heel contact 80% of the time before he went back to the reevaluation. During this time, during physical therapy, they used stretching, strengthening, neuromuscular re-education, and some home exercising to address the range of motion limits. After that, the parents and the teacher, which the parents relayed any information that they needed to know to the teacher about the patient. The student claimed that after the 4th week, he began to walk 100% bilaterally on his feet, on his heel, with heel contact 100% of the time after the 4th week. And after the 17th week, the patient began to squat 35 degrees without his heel coming up, and the range of motion limits increased, which were a good sign that the physical therapy was working and could avoid surgical options. And after all of the physical therapy was done, the range of motion limits went from -6 to 7 degrees on the left foot and -10 degrees to 0 degrees on the right foot. He also walked flat footed 100% bilaterally, and the surgery was avoided from the patient, and the young boy was able to be a kid again. And the parents were happy that the physical therapy worked because they didn't want him to go through the surgical procedure, and so he could get back to playing with his friends normally. And even though it wasn't perfect, even though it wasn't normal, he didn't walk normal ever again. The physical therapy increased his motivation to do anything that any other kid should do. Thank you.